topic we cover today is counseling process. So if you see all the individual, one or the other way, they may be suffered or they may be having certain issues. And what we'll do, we'll get help from our elders, parents, friends, or any other family members, or from our teachers. And if you come to the educational setup, there are two terms that usually we used to hear to solve the problems of the students. That may be the guidance and counseling. And today we are just going through the counseling process. What are the various phases of counseling process? Now I told two terms, that is guidance and counseling. So most of the person, they are using the guidance and counseling as a synonym, but there are certain difference will be there and both are little bit different. Now we'll just see the meaning of guidance and what is a counseling. After that we'll move to the counseling process, that are the phases of counseling detailing. First we'll see what is a guidance. So if you see the guidance, the word itself it says guide. That means we are giving some way to some person, or we are leading to some person, or we are giving certain direction to the some person. That is a guidance. That means it is a some form of help given to one person. So what are the help we will be giving to the person? It may be where he wants to go, what he wants to do, and how he can accomplish that need. So this is, we can term as a form of guidance. And in education setup, it is very, very important. Why? Because if the person complete his 10+2 or what we call intermediate, so they will be having a confusion, what I want to do next. Or if the person completed his graduation or higher studies regarding the job, they may be having a confusion. Or if any person is having certain personal issues or any type of health problems or any social issues, what they want to do, how that problem can be solved. There the term comes guidance and counseling. So the guidance, we are just giving certain different types of solution, or we will be giving different types of way to the person. We are not selecting or we are not focusing in the problem solving. We are giving different solutions there, or different ways we will give in the guidance. But if you come to the counseling, we can say that the counseling, it is one of the specialized service of guidance. It is a part of guidance, we can say. So here what we will do, we will exactly help the person to go for a decision making or to take up his responsibilities of life. That means we will exactly give the solution, different solution we had given in the guidance. Here in the counseling, the exact solution, how he can solve his problem, that will be selected in the counseling process. And usually this counseling will be given by a, what we can say, trained or professionally qualified persons will be giving this counseling process. Now we will move to the definition of counseling. The counseling, we can say that it is a helping process. Here a qualified person, usually a professionally trained person, we can say, they may be purposefully gives his or her time or attention or skill to assist a client. That means there will be a counselor and there will be a counselee. The person receives counseling, counselee will be there. So we are giving, the qualified person, they are giving their time, attention, skill to a person. Why we give this time or skill to the person? It is nothing but to explore the problem. Okay, explore the problem means to identify the problems of the person, and we have to identify and act upon the solution. We have to identify what is the exact solution the person can be solved, and we will be going for the within the limited time or within the limitation of our setting, we will be doing this particular thing. That we can term as a counseling. It is nothing but there will be a counselor, a qualified person or a trained person, and there is a counselee. Those are in a need of certain help. So this counselor will be giving his time or attention or skill to this particular counselee. So why this process will be to solve his problem. So these are the meaning of guidance and counseling, we can say. Now we will move to the counseling process. The word itself, it says counseling process. Process means there will be certain steps or there will be certain phases are there. So now we will see what are the steps or phases of counseling. So while coming to the phases, the first one, it will start with establishing a relationship, then it moves to the assessment, then it comes the setting up of goal, intervention and the termination. So these are the 5 important phases of a counseling. So let us talk about the first one, establishment of a relationship. That is very, very important, because in the counseling, already I told there is a counselor and counselee, and it is a face-to-face interaction. That means the counselor and counselee will be sitting together to solve the problem. So that means there is a face-to-face interaction, and there are certain important aspects we have to consider while start up with a conversation or with an interview. The first thing, there will be a nature of the individual. That means we may not trust other person. So in the counseling process, in the establishment of relationship, the first and important thing is maintaining a trusty relationship. So if you go for a trust relationship, to maintain the trustworthy relationship, so initially the person, the counselor will be a stranger to the counselee, as well as the counselee will be a stranger to the counselor. So the first thing, they will be fixing a appointment, a proper appointment according to the time of the counselor and the counselee. There will be a proper time schedule will be fixed up. Then the counselor has to introduce to the counselee and ask the counselee to introduce himself. Then actively we have to listen the counselee, as well as there should be a physical comfort should be there, ensure the comfort of the person. In between we should not talk. Whenever the patient is feeling or ventilating his emotions or whatever he is talking, we should not interrupt in between. Actively you have to listen. That means the person should feel that, okay, there is someone to hear me. So then automatically he will try to what we can say, ventilate his feelings or what is there in his mind. So all these things which comes under the first step, that is the establishing the relationship. Moving to the second one, the assessment. So that is a crucial step. In this assessment, here we are identifying what are the problems the patient is having, or what are the problem the student is having, or what is the counselee is having problem. So here it includes the assessment of it includes the data collection. That means the problem will be properly we have to identify, encourage the patient or encourage the person to ventilate his feelings. So wherever we need a clarification, clearly, specifically you ask to the person, so that the person can explain detailedly regarding his particular issue. That comes under the assessment step. Moving to the third one, setting up of goals. So now we have a list of problem what the patient is having. So now we'll make this into two types of goals. One is short term and immediate goal, another one is a long term goal. So what is the short term goal? Immediately, okay, immediately what are the problems that need to be solved? That comes the short term goal. Another one, long term goal. That means it takes sometimes some time to solve this issue, and it is for a longer duration. Moving to the next one, intervention. So now we have person's problem, we made the goals, and now intervention. What are the different techniques we can use to solve the person's problem according to his needs? That comes the fourth stage, that is the intervention. Moving to the last one, the termination and follow-up. This is also a crucial stage, because now we had identified all the problems of the person. Then we have used certain techniques or certain intervention we were used to solve patient problem. And it may take some time, within a one day it may not be possible. Maybe different sittings we may go for, or different techniques it may take according to the person's problem or need. Sometimes a longer duration it may take. So once the person's problem is resolved, so we have to end up the relationship, that is the termination phase. And if we need any follow-up care, means afterwards we want to see whether the patient's problem is solved, or there may be sometimes the risk factor will be there, again it can come, the relapse will be there. So we may require to go for certain follow-up care for some of the cases. That comes the last step, that is the termination phase and follow-up care. So these are the phases of what we can say counseling process. So today we have seen regarding what is the meaning of guidance and counseling, and what are the phases of counseling process. That's all for today's class. This is Vishant signing off till we meet the next video. Thank you.